I see a lot of patients in the office complaining of shoulder pain. Sometimes it starts with an injury, sometimes it doesn't start with an injury. Often they come in with not just pain, but loss of the ability to do certain daily activities or loss of motion. We look at the patient, we get a physical examination, often we'll get an MRI, and if a patient has a rotator cuff tear, many of those patients will come to surgery. We repair those rotator cuff tears with suture anchors that actually allow us to sew that rotator cuff back down to the bone. The surgery takes about an hour and a half, and it's all arthroscopic. We have a number of techniques that we do to really limit how much pain a patient has afterwards. One of the big parts of a rotator cuff repair, though, is the afterwards physical therapy. Depending on how large that rotator cuff tear is, sometimes the patient is immobilized for a period of time. We start a physical therapy program according to a protocol designed around the patient's actual tear. And recovery can take somewhere between 3 and 5 months, really depending upon how big that tear is, what kind of activities that patient has to get back to. If there is a rotator cuff tear that's not really repairable, there are other options. There's a newer option that we're doing called a superior capsular reconstruction that actually helps that patient with pain and function, but doesn't totally repair the rotator cuff. And finally, if it's really bad, there are certain total shoulder replacements that we'll do for bad rotator cuff tears.